On to one of our top stories this evening. Health unions are concerned about the rise in COVID-19 cases in the country. Unions are warning the country's overstretched healthcare system will not survive the second wave. Minister of Health Zola Saphetha says the spike in numbers is as a result of the new COVID-19 variant, which is spreading faster than the first wave. Nehawu General Secretary Zola Saphetha joins us now for more on the story. Many thanks for your time this evening. Let's perhaps start with your engagements that you've been having with your members and some of the biggest fears that they are expressing as we battle with the second wave.
Good evening to you and the viewers. As you will know that we are from the first wave, which was really society was mobilized over a narrative that says that this virus only appears to be strong and existing in winter. But now we see something contrary to that narrative that have been perpetuated to society, as we are observing the impact of the second wave in summer. And that puts more pressure, because you recall that before the second wave, there was just an assumption or an impression that resulted to complacence, as if the virus is going away. And as a result of that, we lower our guards because of the numbers that were reported and the focus on the coronavirus. And we waken up to reality by the realization of the second wave. So firstly, our members are confronted with the effects of the complacence that had occurred across the country, particularly in the health sector. But two, because they have not been prepared, psychological, but also educational in terms of the nature and the pace of the second wave. As a result, that they are, grappling to understand the essence of the second wave on one part, but on the other part, there's a whole logic and the conduct and the behavior of society, which to a great extent does not really take this virus serious. Hence, the unnecessary gatherings. As a result of that, we are observing the number of stabbings, people stabbing each other increasing, but also the alcohol consumptions, which lead to car accidents that are unnecessary.
Mr. Saphetha, I want to come in here. These are very important points that you raise about the complacency that's come about, but I find it very interesting what you mentioned a moment ago, is that the healthcare fraternity hasn't really been educated about the second wave and how it works. How do we correct that as fast as possible so that we get ahead of the situation before it gets to the winter period, for example?
We will follow what we did also when we were confronted with the first wave, because as Nehawu, we took upon ourselves, together with the Minister of Higher Education and CITAS, including the National Institute of Communicable Diseases, to train our people at the level of our shop stewards, but also healthcare workers, to appreciate the nature and the pattern of this virus and what are the measures put in place, and orientate them in such a way that they play a critical role from something that they know. So that's why we were asking a meeting with the minister, which now is going to take place on Tuesday. And a part of the thing that we're going to be raising is an extent to which we bring awareness, firstly to health workers on this, but also to society. And also try to raise an issue of bringing the Department of Communication so that it can also use its instruments to communicate a correct and proper message about this, so that we deal with the issues of distortions and people playing around this COVID, because this is not something to play around. because it's a serious thing that is killing and is finishing us as a society.
Yeah, I'm sure one of the other important conversations you'll be having with the Minister at your meeting is the vaccine and who should be getting it first when it arrives in the country. You as a union, your thoughts on that vaccine and what will you be communicating to the Minister?
You'll remember that our first entry point in as far as the health sector is the establishment and the compliance with the Occupational Health and Safety Act, which places the responsibility to the employer to put measures to ensure that the lives of the health workers are protected firstly, so that whoever comes to hospital for help can be served by people who are protected, who are infection-free, so that they don't spread this from themselves to patients. So that's the first one. Secondly, you remember that when we were welcoming the arrival of Cuban doctors on the 25th April, we followed that with a call to quickly go to Cuba to procure COVID as a vaccine that has been proven to be working. So in our view, we need to as and when they procure, because the issue is, because there's no clarity, there's a confusion now, as you will know, that the government is grappling to explain whether the delay and so forth. We want to hear from horse's mouth in that meeting as to whether or not are we in a position to receive the vaccine, if so, when that would be. And once we are clear on that, then we have to get into details. But as you know, we'll prioritize the working class and the poor as the most people who are highly affected by this and people who have no means to interact with hospitals, because in South Africa, to access hospital, it depends on the pocket. So we want to place on record that our entry point will be those who don't have anything in their pocket, who are vulnerable to hunger, and also issues of means to hygiene and so forth as a primary people to be considered.
Many thanks for your insights there. That's Nehawu's General Secretary, Zola Saphetha, giving us insights on what the members are concerned mostly about as they deal with the second wave.